Good afternoon, everyone. My name is Bob Benson. I'm the chair of the Perth and Kinross Integration Joint Board, and welcome to our meeting for Wednesday, the 29th of March 2023. We've a very substantial agenda today of some very important items, and after we have done welcomes and apologies, we're going to slightly tweak the agenda to bring some matters forward that will enable two external speakers to support the papers. Thank you. Okay, Scott, can you give us any apologies for the meeting, please?
Thank you, Chair. Good afternoon, everyone. We have apologies from Bernie Campbell. Don't think we have any other apologies unless there's any others to be submitted.
Thank you very much. Are there any declarations of interest today concerning the agenda? No, thank you. I indicated earlier that there would be a slight change to the agenda today to accommodate two external speakers, Peter Lefevre and Keith Russell. We brought this item forward so that we can gain the benefit of their input and contribution to the Mental Health and Learning Disability Improvement Plan, which I now propose to move forward to the next item on the agenda. They'll be able to stay with us until about 2 o'clock, so we've got plenty of time for that discussion. So I wonder, Peter and Keith, if you could just introduce yourselves, just say who you are for those who are maybe not familiar.
Chair, thank you. I'm Keith Russell. I'm the Nurse Director for Mental Health and Learning Disabilities in Tayside, and just to advise, Chair, that Paul Arbuckle, Associate Director for Service Improvement and NHS Tayside, has joined us as well.
Thank you.
Hello there, it's Peter Lefevre. I'm the Consultant General Adult Psychiatrist and the Operational Medical Director for Adult Mental Health and Learning Disabilities across Tayside.
Thank you very much for your attendance today. Greatly welcome it. Okay, then I'm going to go straight over to Jackie Pepper, who's the Chief Officer who will be leading on this discussion.
Thank you very much, Chair, and I'm pleased to bring this update report and the Mental Health and Learning Disability Improvement Plan to the IGB this afternoon. The Perth and Kinross IGB receives a report on mental health services at each of its meetings, and at the last meeting, the route for approving the detailed action plan to address the 6 priorities that were set out in the Independent Oversight and Assurance Group's final report was agreed. And it was agreed that we'd bring the improvement plan prior to submission to the Scottish Government, which was at the request of the Minister of Mental Health and Social Care, to each of the 3 integration joint boards and NHS Tayside board in succession. So I'm pleased to present this detailed action plan, which is produced for you at Appendix 1 of this report, and that's for your approval. And noting that it was considered by the Tayside Executive Partners at a meeting on Friday the 24th of March. It has been considered and approved by Angus IGB on Monday the 27th of March, and Dundee Integrated Joint Board approved the plan this morning. The NHS Tayside board will consider the plan at a special meeting of the board tomorrow. It's important for the Perth and Kinross Integration Joint Board to recognise that this is a whole system improvement plan, and it aims to improve service provision for the population of Tayside, and therefore it requires considerable collaboration, not just in its development, but also in its delivery. And as a reminder for this IGB, as Chief Officer for Perth and Kinross, I have a lead partner role in coordinating the strategic planning for inpatient mental health and learning disability services, but it is for each and all of the IGBs in Tayside to set the direction for the strategic plan and for the commissioning of these services. The plan currently focuses on the 6 priority areas raised by the Independent Oversight and Assurance Group. And you will see in the covering report that it's recommending that this is further developed by the end of June 23 to include 4 further system-wide areas for improvement and to use the same format to report on these. This will then form the revised strategy for the whole system change in mental health and learning disabilities for the next 2 to 3 years and refines the number of priorities within what was Living Life Well and moves forward on these in line with the key message to do so in the Independent Oversight and Assurance Group's report. So in terms of refining the governance, there's greater clarity within the integration schemes, and we've spent some time looking at that in detail, and it defines the role of the 3 integration joint boards on NHS Tayside in relation to inpatient mental health and learning disability services. And it's clear from that that the 3 IJBs will need to continue to develop ways in which they work together and put this into practice. So much progress has been made very recently, particularly with the chairs and vice chairs taking this forward. And we've already recognised that more needs to be done to involve the wider membership of the IJB. In terms of stakeholder engagement, it's a similar position. There has been notable progress with key stakeholders, but much more still needs to be done. And the plan sets out our commitment and proposals for doing so. So as a final comment, the consideration of the plan over the last few days has sought to bring forward a full equalities impact assessment by the end of June, a request for more detail on engagement work already completed to be put into the plan or in a covering narrative to it, a stronger focus on the development of the financial framework to support the delivery of the plan. But there's a key message that is coming forward, which is that this is going in the right direction. So I'd like to recognise the work that's gone into developing the plan across many staff in a whole variety of different aspects of our service provision, and particularly recognition to Paul, who's here today, and the programme team that he manages. So particular thanks to them. And I'm pleased that Peter, Keith and Paul are here to assist in answering any questions that the IJB may have. Thank you.
I now invite questions and comments.
Apologies, Chair. I'm unable to raise my hand, but I have put Q in the chat for a question.
We have that. Thank you.
Can I go ahead? Is that okay? Sorry.
Ian, I've asked Ian to start first, and
Oh,
then
apologies.
it's okay. I've asked Ian to start first, and then Lindsay. Thank you.
Ah, I see you green. Yeah, thank you. I'll get it right at some meeting. Bob, can I first of all say, in reading this report, not so much enjoyed, but was favourably disposed to the way in which the tasks have been set out and the way in which the kind of agreement about who's in charge in what areas and the coordination of that and the timescales concerned. But there's one area, of course, and you will rightly say it's not our duty to deal with, and that is CAMS and young people. But at some time, it would be useful for us to look at how the edges of children's services and adult services come together and what work is getting done in respect to that. I raise this because it's something that's been raised with Sandra and myself, and in fact Sandra I think sent a detailed note to Jackie. It is also true that from experience that many of the children involved in these services come from dysfunctional family situations, and may have the parents been assisted, supported, whatever, by social workers. And I sometimes concern myself in reorganising the services that we end up with a duplication in the one family about resources to the family, the overarching need to coordinate the activities and who takes responsibility for that. So that's generally the question. Thank you.
Thank you very much for that, and I welcome your comments. Thanks very much. I'm going to ask the Chief Officer to respond to your latter point about children in transition, but if you want to take that one first, Jackie.
Thank you very much, Ian, and thanks for your question. It's important for the IJB to note that Children's Services is not delegated to the IJB, nor to the Health and Social Care Partnership. So the management arrangements around that and the reporting in terms of the governance is actually quite different. And I did reply to Sandra's email this morning, and happy to give a bit more detail and signpost to the relevant people and partnerships around that. So, for example, in Perth and Kinross, there is a community mental health and wellbeing strategy for children and young people, and that reports to the Children, Young People and Families Partnership. It wouldn't be coming to the IJB, but I think it is important to recognise that that will be promoting a whole family approach. So that is about supporting all of the family and adults within the family, and that there needs to be connections there. And it's something that we've been considering quite closely in our discussions at the programme board that's referenced in the paper as well, in order to ensure that, yes, we remain connected and that the support for people in transition is a key area. But in terms of refining the priorities, that was one area that we needed to sort out some of the governance there, so that was clear. Otherwise, we've got people reporting to different places on the same thing. So it was about refining that and making that easier for the people concerned. But your point about a whole family approach is something that we need to recognise throughout the work, and that's not just within Children's Services, but also in terms of the work that we are taking forward within our community mental health and wellbeing strategy. So when that comes back to the IJB with an update, I think that's something we can address within that, about how we're addressing it.
And thank you very much for the email that you sent to us earlier formally. Thank you very much. Appreciated that input. I'm going to bring in Lindsay Glover.
Good afternoon, everybody. I'm actually going to ask if you start calling me Lindsay Hunter now, if you don't mind. I've changed my name. So I've got one question. It's actually a comment which I think I'm going to answer my own question, if that sounds ridiculous. But Jackie came to the Area Partnership Forum with this paper to advise NHS partners in what was going on. It's what she said about the stakeholder involvement. It's really just to emphasise that myself as a stakeholder within the IJB would really, really appreciate to be more involved in this situation. I know that we have a mental health partnership forum and everything on NHS side, but it's just so that everybody's appraised, and I know that's something that we can do within the NHS. But there's one thing within the report that, as a staff side, are quite concerned about, is it seems like the option 3A is now running around again, and this is a single site option for Strathmartin. Now, obviously this will be discussed within NHS side, but it's just to ask that stakeholders, meaning staff side, are more involved. That would be excellent. Thank you.
Thank you very much, Lindsay. Before I bring in Jackie, I do apologise for getting your surname wrong. Sorry. Jackie.
Thanks, Lindsay, and thanks for raising that, because I know we've had opportunities to discuss that only just last week. But the plan is setting out an intention to ensure that stakeholders, as in staff and staff working at all levels, are engaged in this. So the commitments there. How effective we are in that, we need to hear back from you as how well we're doing on it, and keep that conversation going. So thanks for raising it. I see Paul's nodding as well. So I don't know if you want to say anything on that, Paul.
Thanks, Jackie, and hello to everybody. Paul Arbuckle, Associate Director for Improvement, NHS Tayside. Yeah, just to echo what you just said there, Jackie, Lindsay, would love to have your involvement. We see the engagement around the workforce as requiring what we learned loud and clear through the oversight and assurance group process over the last year was there are the formal mechanisms for staff engagement that are really important in ensuring that the staff governance standards are upheld at all stages of our developments. But equally important to that is the informal staff networks and the way that people experience working in the Tayside area, how they relate to each other, what they talk about and what they work on together, both for better and for worse, is a really important part of all of this. So we need to have our staff side colleagues right alongside us at every opportunity, and that's our intention. And we need we've got a lot of work to do around engagement, both for staff and for our communities around this work.
Thank you very much. Sheila McCall.
Thank you, Chair. My comment, first of all, is just to say it's very pleasing to see this report and laid out in a way that is actually quite easy to read and follow, which is very welcome indeed. I have a couple of sort of comments, I suppose, and there may be a question around it. The one comment I do have is around outpatient services. I know that this is a review for inpatient services, but and I'm sure I've mentioned at this forum before or at the Health Board, that to do this in isolation from inpatient services and how they're structured and designed and staffed and located is hugely important, because from both a prevention and a recovery perspective. So although it is mentioned in item 9, I think by January 24 there will be a review of inpatient services among a range of other things under, I think, priority 1. I suppose I'm really looking for some assurance that that will be quite a comprehensive review and that it will take into account the action plan for this review, and if the review of these inpatient services include, and the other areas you're looking at, or sorry, outpatient services require some adjustment to the inpatient review, that will be carried out and not vice versa. So that's kind of my first comment stroke question. And I suppose, and the other question, the other comment I have actually is following on from Ian's point about the children, young people and families partnership. And I'm just wondering if perhaps it's worth considering having somebody, if they're not already there, from that partnership as part of the overall team looking at this, even if it's just an attendance for support, but that may already be covered. And my final point really is around the single site at Strathmartin. If I put on my purely parochial Perth and Kinross hat just for a moment here, both Strathmartin and indeed Carsview are quite a distance away, and for family members of inpatients it's extremely difficult and sometimes stressful to be far away from their locality. So while I understand some of the logic behind it, I'm not entirely convinced that other than organisational purposes that it's the best possible solution for Perth and Kinross in particular, particularly some of our rural communities that are so far flung from both Angus and Dundee.
Thank you very much. Thank you, Sheila. I'm now going to bring in Jackie, and Jackie may bring in the other external participants as well if you wish.
Thank you very much, Councillor McCall. Oh, can you hear me all right? Yeah. Thanks for your question. I'll take them in succession. The first one was around a question about the redesign of outpatient services, and I'm really pleased that we have Peter here, who's jointly leading on the whole system redesign of our community mental health teams and the approaches there, because they are actually, as you say, very interlinked. But just to refer you back to paragraph 2.7, where we're saying that very area of improvement, that work stream, we're going to build into the plan and bring that forward in June. So I'm just going to hand over to Peter to say a few words on that, just to give you some reassurance that that is very much a priority and very much seen as an integral part of our whole strategy. Peter?
Thank you, Jackie. Yes, that's absolutely right. The paper, as presented, is a direct response to the oversight group and the 6 recommendations. But what is, in a way, hidden is quite a bit of work that's going with the various other work streams, and the community mental health, secondary care community mental health redesign is a very active work stream that's going on. We've only yesterday had established a good working steering group to take this forward, and we've got an action plan going over that will be developed, over the next 6 to 12 months with definite changes. And I think it is seen as completely key to the whole system redesign, because getting community services right will inform the need for the acute inpatient services and how they're going to be redesigned. So yeah, an absolute appreciation that it's all integrated, and the secondary care community services, along with primary care mental health services, are going to be absolutely key to this whole process in the tiered approach, I suppose, to mental health redesign. But so very happy to share progress in that in due course.
Thank you. That's really helpful. And I think that, I would point out that, learning disabilities is quite diverse as well, and has perhaps different requirements, particularly for outpatient services, irrespective of any inpatient. And I think the diversity of that particular cohort needs to be clearly understood and considered. Thank you.
Yeah, thank you.
Thank you. And your suggestion around ensuring that there's representation for people who are taking forward the strategic approach to supporting children and young people's mental health and well-being, Councillor McCall will take that on board in terms of making sure that we can describe the connectivity there, and that if that's about people joining different groups, then we'll find out the right way to do that. Your final comments were around the dedicated site for both general adult psychiatry and inpatients and learning disability. And you'll see in this plan, it doesn't propose any particular way forward on that. What it does is set out the key stages in a process to be bringing options forward for decisions there. So it's not making any particular recommendation at this stage. So please be assured that the needs of the entire population, including those who are furthest from the current provision, will be taken into consideration in that due process. Thank you.
Thank you. That's very reassuring. Thank you, Chair.
Colin Stewart.
Thanks, Chair. Thanks to the Chief Officer and all the staff that have been working on this. It's good to see that it's been pulled together on time, and that we'll be able to deliver this as to the Scottish Government as required. But more importantly, that we've actually got a manageable, sensibly broken down and prioritised plan to actually deliver on the key activities that are in there. I think in particular for the plan as well, the layout's much easier and more manageable than the previous draft version that we saw. So thanks also for that. One observation and one question, and then a question on a completely separate topic. My observation is that, and I know we spoke about this before, Chief Officer, there are quite a lot of actions due in June. I don't think it's as many as it was when we spoke before, but it is now still 11 actions, I think, due this June. So just a wee bit of a concern about the bunching of the actions and the deliverability of that, although I do know that they're split across different priorities, so we'll be getting managed differently. If I could just ask, one of the issues that the Independent Oversight and Assurance Group raised was about governance for mental health and their concerns about the lack of clarity about that. I know that we've discussed previously that the revised integration schemes provide a necessary clarity, but we are introducing here an executive leadership group, and under their purpose in section 1 in their terms of reference, there is about them initially providing strategic leadership, but there is also about them providing strategic direction. That's mentioned 4 times, and also devising and delivering a property strategy. Just to be absolutely clear that the executive leadership group is there to sort of manage the implementation, and that strategic directions will be taken by the 3 IJBs.
Just to say yes, and if it requires an adjustment to that to make that clear, I'm happy to propose that the terms of reference are updated to make that clear. Councillor Stewart, thank you.
Beth Hamilton.
Thank you very much. Can I just welcome the report and endorse the comments about timing and how well it reads. Just a couple of wee things from me. Just when we're looking at the review, and I take on board, Jackie, what you were saying around the fact that we're not making a decision about bases, we're looking at the process. But I just wanted reassurance that we'll be looking at all aspects, including the Carsview PFI timing. I'm not sure when the contract's going to end, but I'm imagining that will play a part as in some of the discussions. Can I be reassured of that? I also welcome the detailed financial framework commitment, so we have a real sense of finances, both within, to compare that flow through with communities and inpatient services. And the last thing, it's just a nosy question, and I suppose it's about the patient safety. And I'm really interested to hear a wee bit more about patient safety. Have we still got the national patient safety initiatives that we will be working with, or is this a purely NHS Tayside development around patient safety? Thank you.
Jackie, do you want to start that, and then we'll introduce the other speakers?
Thanks, Beth. I'll pick up on the Carsview, the ending of the PFI contract, which I think is due to end in 2025, and that there's a current work stream looking at that, headed up by the Director of Facilities for NHS Tayside. But the timing of that in terms of bringing forward this plan is key, so we need to make sure that these dovetail together, and that's maybe not clear in here, but it's something I think in terms of further development of this plan, we should probably include that. And I'm looking at Paul online, not sure if he can see me looking at him, but I think that's something we probably should include in there in terms of the timeline. Thanks. And I'm just going to pass over to Keith and Peter in relation to the patient safety work stream which they're leading on. Thanks.
Beth, thank you for the question, and yes, you're right. There is a Scottish patient safety programme for mental health that's been reinvigorated in recent months post the pandemic, and it's entirely focused on inpatient services, and NHS Tayside is engaged with that programme of work as one of the sites involved in the programme. Specific focus on restraint reduction and understanding the factors that contribute to the use of and reduction of restraint within inpatient services.
Thank you. Well, do we hope to develop that into some of the community services? Because I just wanted to mention that, I mean, my clear understanding, although this part of it is focused on the inpatients as a response to the IOD, that we are looking at the whole system. It's not just inpatient. I think Peter confirmed that. So I just wanted to confirm that that was my understanding. So I was just wondering if patient safety was going to develop through our own local groups into some of the other issues that are not just solely inpatient.
I can come back on that then to say yes, that is correct. There is a need to look beyond just inpatient services to consider patient safety in the context of community-based services as well. And Peter and I have had an early meeting with Maura McRae, the Patient Safety Development Manager in Tayside, to start to think about how that work can be developed to include the community.
Thank you. I look forward to seeing that progress. Thank you.
Thanks, Chair. So yourself, Chair, and I had the opportunity recently to visit both Carsview and Strathmartin, and thanks very much to, gosh, I'll be difficult to name everybody, but Keith, Pete, Gordon, Lindsay, Louise, Leslie, and all of the teams who supported us in that, and for showing us around and being very frank as well in addressing our questions. One of the things that came up, which is specifically mentioned here as a top level priority, is about the physical environment at Strathmartin. We've got a note here that the analysis of the current environment has been completed, and I just wondered what immediate actions there might be that could be taken to improve the environment, and when we could get an update on that.
Thank you. Presumably timescale. Yeah.
I don't personally have the detail on that, and I'm not sure if either Keith or Paul's indicating he doesn't have that, but I wonder if that's something that we need to bring forward to the next meeting of the IGB in terms of the detail around that. If I'm unable to provide it at the moment, it doesn't look as if anyone else has that detail, because this is being led by Lindsay Bailey as General Manager for that site, and the property services, so we'll bring that forward.
Thanks very much.
Sandra Auld.
Sorry, thank you very much, Chair. Could I ask if it would be possible for the terms of reference for the executive leadership group to be amended to include a public partner as part of that membership?
Jackie?
Sandra, it's not something that we've looked at specifically at this stage, because you'll appreciate that a lot of the focus has been on developing the improvement plan in a very short time scale. The programme board, which is mentioned in here, is currently reviewing its terms of reference, and there is significant representation. I've just had a look at the membership as it currently stands, which will be reviewed, but there are at least 11 members on the programme board who are either people with lived experience or people representing the voice of service users or advocating on their behalf. So that's something that we can perhaps consider in terms of the refresh of the programme board terms of reference, and what that might mean in terms of reporting to the executive leadership group. But it's not something we've considered to date, but something we can take forward in our continued review of the programme board and its membership. Thanks.
Thanks very much. Yes, I think we need to have quite a discussion on that because of the, if you remember, of an IJB as well. It's just simply a conflict of interest potentially. But I think the principal point of what that you raised is actually quite an important one. But we'll come back to that in the timescale that the chief officer has indicated.
Can I just come back on that, Bob? The representation wouldn't necessarily have to be a public partner from the IJB. So the conflict, I guess it's just the principle of public partner representation.
I think I acknowledge the principle, and thank you for clarifying that further. Thank you.
Apologies, Chair, but I was listening to the discussion and one or two issues have come up during the discussion. The learning disability section in 2.7. Are the group considering involving those who use the services who are themselves disabled in terms of their mental health, their mental capacity and health? Or is it because I used to be president of a large MenCap group because we've got family and who require services. And we started a programme which wasn't just about learning in an institution, it was also for those as they begin to transition into adulthood, skills training and engagement with them, which has now led to substantial numbers of them actually being directly employed and in a range of different skills that satisfactorily engage with their employers. I was wondering if in this group here, if the issue around transition and employability could be added. I don't need an answer right now, yet I think it's something going forward. It is important that the young people themselves who become adults have got a sense of their own well-being and a sense of their capacity to do things and be involved in things.
And thank you, Ian. That's a very pertinent question. Jackie.
Thank you very much, Chair, and thanks, Ian, for raising that. And I see that Kenny, in terms of our own local strategic delivery plan, may want to say something around this. But each of the health and social care partnerships, I'm certain, across Tayside will have lots of examples of how people who use our services or rely on them are actively involved in their development and redesign. And only just last week, I was in this very room where we had an exciting third meeting of what's called a redesign, a jam. It was called, where we had people with learning disabilities and staff coming together to redesign our day opportunities. And the theme of that was very much about what makes a better life and living your dreams and leaving school, going to college, employment, housing, having relationships were all key to that. So it would be really helpful, I think, at some point to bring forward that as an example of how people are actively engaged in redesign. and that their aspirations are at the forefront of that. That was heavily supported by Healthcare Improvement Scotland and supported by Scottish Government. So I think as an example of good practice, we would want to bring that forward. But I know that we very recently had a report on the work that's been taken forward by the Scope team around transitions, and Kenny probably wants to say something about that. But that kind of work, that kind of approach to engagement is something that I'm really keen to see across all of these work streams. So really just a reassurance of a commitment to do that. I think that will require significant resource and upskilling and capacity building across our workforce to be able to do that. So that will be another issue for the financial plan that you mentioned earlier, Beth. So I'll just put a wee marker there that was something that we'd want to see in this delivery plan. Thanks.
Yeah. Oh, I think I'm on. Yeah, as Jackie said, there is a lot of work going on locally regarding transitions and employability, and we do have a network for consulting, engaging with people locally as well. Always looking to improve that, but again, as Jackie said, there is work going on across a range of service areas, including daycare, day opportunities, employability, etc. So yeah, like I say, happy to provide more details of that offline, or might be a topic for a development session at some point.
And finally, Beth, and then I will move to recommendations. Thank you.
I'm just really interested and welcome what you've just been saying, Jackie, and it was just from a governance perspective, I would be more than happy to attend any events or be able to get engaged, and I'd welcome hearing something offline, because it's that kind of thing that I think it would be good for us to see as board members and seeing what's happening. So thank you.
Thank you. I now want to move to the recommendations within the paper for approval by the IJB. First one approves the Mental Health and Learning Disability Services Improvement Plan. The second authorises the Chief Officer for Perth and Kinross IJB as lead partner to submit the Mental Health and Learning Disability Services Improvement Plan to Scottish Government by the 31st of March 2023, following approval by the 3 Tayside Integration Joint Boards and consideration by NHS Tayside Board. The third one requests that the Chief Officer brings forward a further iteration of the Mental Health and Learning Disability Services Improvement Plan for approval by end of June 2023, which includes detailed plans for implementation in relation to the additional 4 priorities, and 4 notes the revised governance arrangements for the Tayside Mental Health and Learning Disability Whole System Change Programme. Does the IJB support these recommendations?
Yes.
Agreed.
Thank you. We will. Thank you. We will now go back to the. Oh, sorry. Thank you very much. I'm too agenda focused. I'm too agenda focused at the moment. Thank you, Keith, Peter, and Paul. Thank you very much indeed.
Thank you.
Thanks.
Okay, then let's move back to the formal agenda then. That now takes us to item 3, which is the minute of the meeting of the Perth and Kinross Integration Joint Board of the 15th of February for approval. Can we check the accuracy before we move to approval? Yes. No. Do you want to point? Jackie wants to raise a point of accuracy.
I'm hoping I'm right in this, but when I was reading this earlier, I noticed that the on page page 9, 7.7, which was the update on the redesign of substance misuse services, but the decision in terms of what was resolved was the progress in the autism and learning disabilities strategic delivery plan. So I think it should be resolved the progress on the substance misuse services and implementation of MAT standards, strategic delivery plan. Thanks. Thank you.
Ian.
Thank you. I remember asking to arrange made for those of you who wanted to visit Strathmartin. I wonder if it can be put in the minutes so we don't forget.
I think this point's already been recorded before, Ian. It hasn't been forgotten because we have a considerable rollout, I think it's the best way to call it, of visits, of which Colin and I rightly have already started that process. So that point is already there. We don't need to further record it, but I'm just giving you my personal support on that. Okay. Colin. Comment from Lindsay.
Again, for the accuracy, it's just that I'm no longer Lindsay Glover. Okay.
Thank you. I was going to make that point later on, but anyway, thank you, Lindsay. Okay, thank you. Can we now move to approve this minute? A proposer and a seconder. Martin Black. Beth Hamilton, thank you. Are there any matters arising? Colin.
Thank you, Chair. It was just that in 7.1, Head of Health was going had confirmed that the strategic options relating to the Invergowrie GP practice proposed closure would be brought back in March. I know that that's not possible, but just to provide an update on that as a matter arising.
Shall we just move? Shall we just move to Evelyn?
Thank you, Councillor Stewart, for the question. Yes, a strategic paper will be coming to the IGB board, proposed for potentially May time. We're just trying to clarify the actual date. The option appraisal closes on the 10th of April, as we know, and the primary care services, along with Dr. David Shaw, will be presenting a paper for comment by the IGB, as we know, not for decision making, but for comment. So that is in place, and we're just trying to secure a time and a date for that.
Thank you very much. That now takes us on to the item 5 action points update. Jackie, do you want to take us through these?
Thank you very much. Happy to do that, Chair. In terms of reference 131, which is the financial framework to support the mental health and wellbeing strategy, I hope that IG members have noted that that's now included within the improvement plan that you've just approved, and so therefore will come forward as a progress update as part of that plan. In terms of 137, that is complete. So a communications protocol has been developed in partnership with Perth and Kinross Council and NHS Tayside communications teams. Reference 138, in terms of those development sessions in relation to the 3-year budget, and we have referenced inpatient mental health in those are now complete. reference 140, which is around the consultation on athel medical practice, the NHS Tayside board papers, and the decision has been issued to IGB members as requested. And in terms of action point 141, we will be building in an update on the carer strategy development session, which is planned for the 5th of May. Thank you.
Thanks very much. Any comments on those action point updates? So we can archive quite a few of these now. Thank you. Sheila McCall.
Thank you, Chair. Thank you, Jackie, for that update. My comment really is in relation to dispositions with GP surgeries. And while I appreciate that members of the IGB have been circulated with information, it is very often local councillors who are on the front line of patient queries. And so I'm just wondering if there's some way we consider, if such situations arrive in the future, that we can include local ward councillors in our communication on these matters.
Jackie.
Thank you very much, Councillor McCall. I think there is a plan to ensure that local board members are informed where there are issues arising in relation to GP practices. Some of the concerns that have been raised are around the timing of that and getting that right, because first and foremost, patients need to be told in advance of anyone else. So getting that is quite a difficult balance to achieve. And sometimes because those notifications are going to patients who don't have access to email, it's dependent on the mail and the delivery of mail, and even within the same postcode can be on different days. So there have been some issues around that, and we can only apologise, but there is an intention, and there is always an intention to ensure that ward members are kept abreast of developments. Thanks.
Thanks, Jackie. I think that'd be really helpful, just to make sure that they're able to answer any patient, or at least direct patient queries to the right place. Thank you.
Thank you. We'll now move on to the finance audit section. Item 6.1, 2023 to 26 budget. Interim Chief Finance Officer, thank you.
Thank you, Chair, and good afternoon, everyone. The report today presents a budget for 2023-24 and requests the approval from the IGB for this budget. It also asks the IGB to note the provisional budgets for 24-25 and 25-26, and to note the work that will be required to bring those years into balance. But before introducing the report, I would like to acknowledge that it's very much a collective effort to get to this stage, and I would like to give my thanks to the Health and Social Care Partnership Finance team for all their work that's gone into preparing for this budget, and to thank the corporate finance teams in both Perth and Kinross Council and NHS Tayside for their support. This allowed us to bring this forward as a well-informed budget that's been based on the latest information available. Also thanks to the executive management team for your support, and the many thanks to the IGB members for your support and challenge and participation in our budget development sessions. You would be forgiven to be quite fed up of me talking about the budget by now, so I do appreciate your patience. However, as with all public sector organisations, the IGB is facing and is likely to continue to face severe financial challenges over the next 3 years. Uncertainties over funding, inflation pressures, workforce challenges, and increases in both complexities and demand make for a difficult planning landscape and require us more than ever to make best use of the resources that we have. Throughout the budget setting process, the clear ambition has been for the IGB to protect frontline services and to ensure the strategic plan and strategic delivery plans can continue to be financially supported. And despite the financial challenges, this 23-24 budget presented for approval today is balanced, and it does ensure frontline services and strategic plans can continue to be supported. Onto the report, it is in 5 key parts essentially. The first being the budget from both Perth and Kinross Council and NHS Tayside. Further detail is provided in Appendix 1. But for the Perth and Kinross Council budget, this includes a share of the Scottish Government funding provided in 22-23 for the additional pay lift. It also includes a pass-through of funding for living wage and free personal care, and this has been made in addition to the recurring budget. The NHS Tayside budget for 23-24 has not yet been set, and it's due to be approved at the NHS Tayside Board in April. We have, however, worked closely with finance colleagues in Tayside and nationally to ensure our assumptions are aligned, and we can therefore present the budget expected, and this does include a 2% uplift passed through from Scottish Government, and again in addition to the recurring budget. The report then summarises the pressures identified, and for 23-24 this is a considerable 13.2 million for both recurring and non-recurring pressures, and further detail on the recurring pressures is provided in Appendix 2. To meet these pressures, funding solutions have been proposed, and further detail on the recurring proposals are also provided in Appendix 2 of the report. In order to achieve a balanced budget for 23-24, the IGB is being asked to approve the use of reserves. This is particularly in relation to the projected prescribing pressure. It's not yet known what the longer term impact will be from recent price increases, and the report proposes using reserves for 23-24, whilst work is undertaken to determine the ongoing risk of cost increases, and also to allow the restart of the local work on quality, safety and efficiency in prescribing. An update on both of these will be brought to the IGB development session in October this year, and this will be key to informing the updated budget for 24-25. The report highlights some of the risks that do remain, and these risks will be monitored closely and reported throughout the financial year. Also, the provisional budgets for years 2 and 3 are not yet recurrently balanced, and we will need to start work early in the financial year to ensure options are available to address this. But in summary, we are pleased that despite the challenges, we can provide members with a balanced budget for 23-24 that ensures the strategic plans approved last year can continue to be supported. So once again, I would like to thank IGB members for your time and your support in informing this budget, and I would be happy to take any questions that you may have.
Any questions for the Interim Chief Finance Officer? David.
Yeah, thank you. In there, it mentions the removal of 5 or something like 5 non-frontline staff from the budget. What do you think will be the impact of losing those vacancies?
Do you want to say which section that comes under?
It's in appendix.
Okay, thank you.
Thank you. The impact has been briefly noted in the appendix, and it's important to note that these posts are mainly posts that have never been filled. They have been posts that have been vacant and were set up to be filled but have never been filled. Therefore, we don't assume a reduction in capacity, but there will be an impact, and we couldn't deny that, of being able to build upon the capacity that we have.
Any further Martin?
Probably a question you can't answer, but I'm going to ask it anyway. The reserves for the prescribing, and it's contingent on getting a deal on prescribing. Is there any indication whether that's going to rise? Because that could be a significant risk.
Happy to take that, Martin. Prescribing alone is our largest financial risk facing not only this IGB, but nationally for IGBs and for primary care, but also for secondary care. ideally we would answer that and say that we're definitely going to see things going down. However, we do need to see what the effect is of inflation potentially reducing and the effect that that will have on prices. We will need to work very quickly this year to come up with a recurring financial plan for prescribing, but it has been noted it's a national risk, and the Scottish Government are taking forward work to try and improve it through their sustainability and value groups. So it's on the page of the highest up, and it certainly is the most significant risk that we carry.
Colin.
Thanks, Chair. I wanted to again refer back to the visits that you and I made, Bob, to Strathmartin and Carsview. One of the issues that came up in Carsview was the use of surge beds, which were sometimes in completely inappropriate locations, certainly not therapeutic. But there did seem to be a large number of, well, maybe not a large number, but a significant number of people on delayed discharge, and I wondered about the provision of some sort of a discharge coordinator who could increase the flow and capacity, and whether there was provision for that in the budget.
I'm going to bring in Jackie for that.
Thank you very much. This is something that we've considered very recently, and in the pressures that we've identified within psychiatry of old age, where you'll see an investment of £850,000 to ensure safe staffing. We've reviewed the costs associated with that and are going to include an additional post, be a social work qualified post with mental health officer training to address the issues around delayed discharge. So that will be included within the investment there, but they will be working across psychiatry of old age, where we have significant delayed discharges currently, and also into Carsview, where we have a few, but they're not large numbers, but we'll certainly put in increased capacity into that through this investment.
Great, thanks. That's really welcome news, and I know that the staff, particularly at, I think we've still to visit psychiatry of old age, but the staff at in general adult psychiatry, you know, we've got qualified nurses sort of phoning up, trying to find placements and chasing up on that. So I'm sure that'll be a real benefit to the staff in Carsview. So thanks very much for that, Jackie.
Thank you very much indeed. Do we have further questions on this paper? Ian.
It's not a partisan political point, I promise you, but it would be perhaps helpful when the appointments are confirmed on health and finance, the minister's concerned that we should write to and ask for being put into their diary to talk to us about the ongoing issues in health and social care and the budgets, and also about the other ongoing work, which maybe I'll get delayed again in respect of the National Care Service, etc. I think it would be helpful, if only getting across that we actually do exist in Perth and Kinross, and we'd like to really a dialogue with them.
Thank you. I think we actually have a formal invitation from the Minister for Mental Health and Wellbeing, as I remember, so we can discuss that with him at any time. Jackie, do you want to add anything onto that question? It's not one I think we can answer.
Only really just to say that we'll use our national networks to ensure that the continued challenges and pressures Donna's nodding because I know that she's engaged in national meetings with Scottish Government and CFOs across Scotland around the financial pressures and challenges that we foresee going forward. So we'll continue to use our national networks to engage in those discussions.
Okay, then, thank you very much. Colin, do you want to come in finally before I move to recommendations? Thank you.
Thanks, Chair. A second question on a completely different subject. Appendix 3 sets out the reserves, and I note that the proposed budget takes us just below the 2% to 1.8%. I'm not especially concerned about that, but I just wondered, in any of the prior years of the IJB, had we ever had to use up in any particular year 1.8% of, the full total of the uncommitted reserves?
Answers no, we've not had to use that, but we've not been in this financial climate before. So this is probably the highest level of reserves we've got, which I feel puts us into a good position, although we definitely do not want to have our financial plans based on the use of non-recurrent funding, but it certainly puts us in a good position for the financial climate we're about to, well, we're in and we're going to stay in. So yeah, thank you.
Thanks very much indeed. I'm now going to go through the recommendations. It's recommended that the Integration Joint Board 1 approves the proposed 2023-24 budget as set out in Appendix 1. 2. Approves the expenditure pressures set out in Appendix 2. 3. Approves the savings and funding proposals set out in Appendix 2. 4. Notes the 2024-25 and 25-26 provisional budgets and the additional work required to bring these years into balance. 5. Approves the deferral of the implementation of the review of contributions policy. 6. Approves the non-recurring expenditure set out in Section 6 to be funded from general reserves. And 7. Issues directions as set out in Section 10 and Appendix 4 of this report. Do we approve this paper?
Yes.
Thank you. I'm going to suggest that we have a brief break and then we'll come back for the workforce, 3-year workforce plan update. Thank you very much. So we'll have 10 minutes, say. Thank you. Okay, thank you very much, everyone. Welcome back. Thank you very much, everyone. Actually, we'll now move to, I should have said 6.2, Audit and Performance Committee, 13th of March 2023, a verbal update by the Chair of Audit and Performance Committee, Beth Hamilton.
Thank you, Bob. Just to confirm, the meeting held on the 13th of March, we welcomed our new interim finance officer to come to the meeting, and she gave us an overview of the financial position. We then covered the strategic performance indicators report, and we really welcomed for the first time the mental health and the learning disability stats, which were really interesting, and with the permission I have shared widely across colleagues as an indicator of positive work. We looked at our strategic risk management and the partnership improvement plan. We then looked at our internal audit progress report with particular emphasis on primary care, and then welcomed our new external auditors to the meeting, and they actually were there to talk through their annual audit plan. And we also had the opportunity to talk about their fees, which I think is Councillor Sheila McCall had pointed out was potentially rising. So we eventually got some detailed feedback from that, and it was noted in the minutes. Along clinical care governance, we had, I think we're settling down, it's fair to say, to some good reporting on clinical governance and how we report that up through the clinical governance structure. So we had some discussion on that, but we noted that they were having a development event to look at the reporting for the governance, etc. We looked at the previous work plan for 22-23, which was signed off, and we looked at the work plan for 23-24 and look forward to working through that. So I'm happy to answer any questions because that's a quick, rapid rattle through. But if there's any questions, I'm happy to take them. Thank you.
Any questions?
It relates to the third page of the report, thanks. Is it related to the audit? Yes, it's related to the audit, yeah. That's my advisor. We've all got to have one now. Now, was there any discussion about the issues around engagement where it's talking about social media and everything, all good stuff, but carers, young carers and service users, are they going to be involved in developing this approach to communications?
I don't think that's...
Ian, I'm not clear which paper you're referring to. I'm taking feedback from the update on the Audit and Performance Committee. That's okay. That's fine. And thank you, Beth. I'm not seeing any other questions, so we'll move on. Thank you very much indeed. And I know also how positive you are about the work of the committee, and I'm really pleased to hear that. I'm now going to move back again. Today's been a bit of a moving feast, I'm afraid, to the delivering on strategic objectives. And that takes us to item 7.2, 3-year workforce plan update. I'm going to ask the Chief Officer if she wishes to say anything before we introduce Kenny to the paper itself.
I don't have much to say other than just to recognise that this is a 6-monthly update, so it's a report on the first 6 months of our 3-year plan, and just to recognise that we'd agreed to put in additional resource to support this, but we've had that on hold for the duration of the first 6 months. But we, with the budget that we've just approved, we know that we do have the resources to secure additional capacity to deliver on this, and we'll bring that in as soon as possible. But I'll hand over to Kenny now. Thanks.
Thanks, Jackie. As Jackie said, this report provides an update on the progress against the actions within the 3-year workforce plan for health and social care in Perth and Kinross. And the plan was approved by the IGB in June 2022, so it's a slightly delayed 6-month update. Since the plan was approved, we've had feedback from the Scottish Government on the plan. Overall, it was positive, saying the plan was well organised and identified the key challenges, but they did say there were a number of areas for further improvement, and these were improving data, demonstrating the links with other partnerships across Tayside, and further consideration of the impact that digital solutions could have on future workforce requirements. Since the plan was approved, a steering group has been established consisting of service leads and professional leads to oversee the implementation of the plan, and the action plan has also been reviewed and slightly streamlined to support implementation. Progress on the partnership-wide actions is in Appendix 1, and progress on the specific staff group actions is in Appendix 2. And actions progressed include, in terms of recruitment, we've had a large recruitment drive in social care, which has resulted in over 80 people applying for posts, and to date 22 have been interviewed and appointed. The Allied Health Professional and Nursing Directorates have supported international recruitment with a number of posts appointed to, and NHS Tayside developing an agenda for change generic job descriptions, and this will improve flexibility and streamline recruitment processes. We've also had a number of actions in terms of developing roles. For example, an associate practitioner role has been developed in psychiatry of old age inpatients, and that's basically for healthcare support workers. It's sort of an enhanced role that takes them just up to just under a qualified professional nursing role. So that then supports people, you know, to operate at the top of their licence, then makes it easier to make the step up to a qualified nurse. We've also continued with the development and implementation of advanced practitioner posts in a number of areas. And there's the ongoing training programme for professional social work qualification. We've got 5 people at the moment in social work assistant posts that are training to become qualified social workers. And we've also appointed a trauma approach coordinator to support the development of a trauma-informed workforce. In terms of data, a pan-Tayside data group has been established and Perth and Kinross is represented on it. We now have a system in place where we have monthly vacancy update sheets which are completed, so we've got real-time information in terms of the number of vacancies across all the professions. Agency and bank nursing levels are being monitored, and workforce tools are currently being tested. And as Jackie said at the start as well, there is provision in the budget for a dedicated post to support with implementation of the plan, and now the budget's been approved, we will progress with this. So happy to take any questions.
Really important area for us. Without the staff, we can't really do very much. I welcome questions. Beth Hamilton.
Thank you. I welcome the report. It's looking positive, but I know it's a very, very challenging area. I was just wondering about the workforce tools. Maybe you might not know this, but I know that they have workforce tools for nursing. And in the old days, we were hoping to get workforce tools for other areas of the workforce. Is that developing any, just when you mentioned workforce tools? Thank you.
Yes is the short answer. Like I say, the workforce tools have been primarily focused in nursing and AHPs. Valerie Davis, our lead nurse, is online. I don't know, Valerie, do you want to come in?
Hi there, yes, we are looking at further developing the workforce tools for our allied health professional colleagues. Currently, just now, quite a lot of our services have run test runs of our workforce tools, and that's getting them used to how to run them quite smoothly, how to reflect back that data that they're getting from that. So when it comes to us actually doing the live run, the staff will be really comfortable with running the tools.
Thank you. I think it's particularly important when we're looking at safety, staff safety levels. But that's great. Thanks very much.
I'm going to bring in Sarah Dickey, then Jackie Jensen, and then Martin.
Thank you very much, Chair, and thank you very much, Kenny, for your report. In terms of page, I don't think it's got page numbers on, but it's section 4 in terms of the progress update, and it's the paragraph just before the P&K trauma approach. There's mention of terminology called fast track into nursing opportunities, and I just would like clarity on the use of that phrase, please. I'm not familiar with fast tracking into nursing. Thank you.
Thank you again. I'll bring Valerie in for that one, if that's okay, Valerie.
Hi there. It's not a terminology I've put into the paperwork, but I think what they're meaning by it is us bringing the band 4s across into the band 5 roles through going into year 2 of the university rather than starting at the beginning. So there isn't any fast track as such. It would be, we've had quite a few now, I think that's 2 or 3 I think we've had that have went for the Open University look from the band 4 training, so it is almost like growing our own nurses, so I'm not sure if that's what they're referring to.
Thank you very much, Valerie. That's helpful. Yeah, for clarification purposes in the report, I understand the picture that you've just described there with regard to opportunities to develop almost like apprenticeship styles or through different banding in support through the colleges. For example, Perth College is very much supporting our role development programme, but it was just to ensure that we don't use fast track because there isn't such a programme that exists. If I may, Chair, in response to Beth's earlier question regarding workforce tools, just building on the observations made by Valerie Davis, the lead nurse, just to say that the safe staffing legislation very much takes into cognizance the need for the development of tools around all those workforce different professional groups that are required, Beth. So historically, inpatient services have had workload tools for nursing for some considerable years, and it's recognising now that, of course, nurses don't just work in inpatient wards, they work throughout our communities and embedded within integrated teams. So whilst there's some experience within nursing, that absolutely must spread, and that work is, as Valerie described, already started with the AHPs. So yeah, those tools are very much part of the safe staffing legislation. Thank you.
Thank you. And Kenny, I think we'll take away that point about fast tracking to find a more appropriate term. That takes me to Jackie Jensen, and then Martin, and then David.
Hello, great report. Really glad to read it. I'm really pleased that you were so successful with that recruitment. That was a really good uptake there. And being able to bring 22 from a pool of 80 for interview was no mean feat, so well done with that. What I wanted to say though, within the context, I'm still learning how we work in Scotland, how our integrated teams work. One of the impressions I got from the report is that there's still a bit of siloing in our workforce plan between the health and the Tayside workforce plan and the workforce plan for the integrated joint board, the integrated work that we've got happening that's this board's responsible for. And I suppose, you know, I'd like, perhaps you could tell me that if that's wrong, but looking at the same paragraph that Sarah referred to, which is the bottom of 69 of 88, where we talk about healthcare support workers using opportunities to develop into those assistant practitioner roles and going on to become nurses in the fullness of time. It may well be that we have social care workers who would like to go into nursing. It may well be that some of those health workers would like to be qualified social workers. So how do we help them look at that training pathway across, rather than you go in, you're employed by health, therefore you look up a health route, or you come into social care and you go up a social care route? So that's really my question.
Thanks for that, Jackie. Yes, that is an area that we need to work on, and like I say, the action plan is an evolving document, and yeah, just based on your comments and the discussion we had earlier in the week as well, we need to put a new action in there. I mean, again, I think, as I said, as I've said previously. In terms of social care in particular as well, it's very much about building that career pathway, and the same would go for sort of the healthcare support workers as well. And obviously, the more flexibility there is there, and the more potential there is for career progression, i.e. going across, or the ability to go across health and social care, that hopefully helps us attract more people into these posts as well. So yeah, like I say, we'll take that back to the steering group, and we will put an extra action in there and look at the passporting arrangements that that we've certainly looked at from areas down south, and look at implementing them up in Perth and Kinross.
Thank you, Kenny.
Thanks very much, Jackie. Martin Black.
That's that. Thanks, Chair, and thanks for the report. Under the quality impact assessment, under 3.1, it's 7388. And it's great to see a quality assessment, believe me, that's something I'm thinking, but what you have is aspirations underneath the improving the quality there, and the further their aspirations. Is there a time frame or a timeline where these aspirations will become reality?
Okay. Could I possibly get back to you out with this meeting there in terms of timelines? Yeah, could you leave that with me? I'll check that out and get back to you. But no, it's a good point. Thanks.
Yeah, I think just to assist in answering the question, Martin, thanks. That this is a 3-year plan. So these are the aspirations to be achieved within that 3 years. So it is ambitious, and I think it's just recognition of the work that's still required to achieve that. But that's what's sitting here. But I think we probably need to update this and give more specifics around this in terms of the quality impact assessment, and bring that back at the next update. Thank you.
Chair, can I come back on that? Yeah, while it's a 3-year plan, I fully understand that, and they're really good aspirations. But what are going to be the first 3 priorities? You've got a 3-year timescale. What are the priorities in the timescale?
Okay, thank you, Martin. Kenny will get back to you on that anyway. Okay, do you want to do that, some of that just now? Okay.
Yeah, like I say, in terms of the specifics, I can come back to you, but sorry, just the time to go through it again. And yeah, a number of those actions are actually included in the wider action plan as well, which do have timescales, but we can just go through and just review those bullet points and make sure they're all captured.
That takes David.
Yeah, thank you. Yeah, this is a good report with lots of good news stories. Is it good enough to keep up with rising demand?
In short, more work to be done. I mean, again, we know, as I said in the report, we do keep a monthly track of the vacancies, and we do still have significant numbers of vacancies in a number of areas, especially social care and nursing. So yeah, work in progress, but a lot more work to be done, and we do still have significant challenges regarding workforce. And again, it just emphasises the importance of trying to get this dedicated post recruited to somebody who's got dedicated time to support the implementation of this plan.
Thank you, David. Sheila and then Maureen.
Thank you, Chair. My question is on Appendix 2 under the attract bit. It's the second one from the bottom, actually, develop recruitment retention pathways into care. And I noticed that it's due for the deadline's the 31st of March 2024. But if we're looking to develop those pathways through schools in particular, I'm just wondering what progress has been made so far on that, because if we do want to have those pathways established by next year, I would have thought we would need to have made some substantive progress on them so far. So I wonder if somebody give me an update on that, please.
And again, in terms of, I mean, it's quite a broad-ranging function. I mean, we do have well-established partner. It should probably split down into a number of actions. But certainly in terms of pathways with the local university at the Highlands and Islands, they are well established, especially in social care. We also have good links with our local colleges in terms of social work as well. Links with schools, that's maybe an area where we need to do a wee bit more. We do have certainly annual days with a number of the local schools as well, especially at with social care recruitment. But again, like I say, we probably need to do that more frequently. That's certainly an area to progress. So yeah, that's maybe an action that needs refined and spread out a bit. And I think my colleague Pauline's going to come in as well with a bit more information.
Thank you. It's just to say that we already have made links with secondary schools to look at career pathways in terms of mapping out and looking at shared experiences and learning and how we can build on foundation apprenticeships that are being delivered within schools. We're also looking at modern apprenticeships linking into with, as Kenny has indicated, the Highlands and Islands colleges and taking placements from there and work experience placements from the college to try and build and strengthen links with the young people to see that they can develop a career in care.
Thank you both. I'm just mindful, in my own ward there are two fairly large secondary schools, and you know, I'm mindful that very often decisions have been made about subjects to take when children are quite young. You know, they're still only 14 or whatever, you know, when they start making choices about subjects and various things like that. So I do think, you know, if we were wanting to pursue that, we'd probably need to maybe do a bit more on it, I think. I understand, Pauline, what you've said, and that you've got links, and that's fantastic to hear, actually. But I do think that we need to maybe have something a bit more regular and a bit more productive, perhaps, that we do get pathways coming from schools into either the college, so that people have a clear idea of what they might want to do going forward. Can I also make a general comment since I have the floor?
Do you want me to? I'd like to bring in Val Davis, who might respond to some of this. Val?
Thank you.
Yes, so just to say that certainly in health, we have just re-established that programme, and we are starting to now take school kids as long as they're 16 and above into healthcare settings, and that's a legal kind of requirement that they've got to be 16 and above, but that is coming from the schools as well as the colleges, and that's to really try again to grow our own nursing staff, to see if they would be interested in having that as a career.
Yeah, so I think in the schools they have staff members who work with young people about possible career development paths. So it's not necessarily getting them in situ, but making sure that they're well enough informed, that they have the right information available from the Health and Social Care Partnership for both health and social care, and also that they can you know, have someone to call on if they need additional information or to be able to answer questions from young people, because very often the choices that they make are before they're 16. And therefore, I think it's really helpful to find a way of doing that. I do know that schools, you know, do try and invite different employers in, and I think it's maybe something that could. My feeling is it could be a bit more refined or accelerated a bit. And I fully accept that they can't always come onto either health or social care settings, but nevertheless, I do think we could think a lot more about how we could, you know, leverage some of that, particularly in our rural communities where we have some very, you know, we've got good high schools there in Perth and Kinross, and you know, we need to think of a way of how we reach out there more creatively so people can think about their career paths when they're choosing the subjects they want to study at school. Because by the time they come to 16, they're probably, many of them may have made up their minds about the career path they want to follow, and health and social care may not have fallen on that. And for a lot of these things, they're the two sides of one coin for many people who work, particularly in the community. So I go back to the points that Jackie Jensen made about, people who may want to go between health and social care, migrate and see their career path going one way or the other. So, I'm more than happy to help inform that discussion going forward, and whatever I can do to help as a local representative to, with schools. So thank you.
Thank you, Sheila. Did Polly, do you want to come back on that? Okay, Kenny, anything you want to?
Just very briefly, I mean, and certainly our interactions with schools is usually involve getting members of staff to go along to career sessions or career events. And, we've had some interest, but not an awful lot, to be honest. So, yeah, we maybe need to just take your comments into account, just look at the way we're actually interacting with the schools. Yeah, thanks.
Thank you. Maureen.
That it. The use of advanced nurse practitioners and specialist GPs. How soon do we expect these people to be up and running, and how will it impact on reducing the amount of locums that we use?
So advanced nurse practitioners in general across the partnership are fairly well established with their frameworks and competency frameworks in place. So we have a significant number of advanced nurse, but I couldn't tell you the exact number. Valerie might be able to tell us, but we have a significant number of advanced nurse practitioners across older people mental health services. We're just beginning to explore, and if our associate medical director was here today, he would say we're just beginning to explore the sort of specialty GP role, both mainly for mental health services, and how we can grow that as we move forward within the sort of medical workforce. So there's quite a lot of discussion going on at the minute, Maureen, as to how we might do that. But it's early days, early discussion, but we have interest in that from a primary care perspective, GPs that would be interested to to sort of train and move through that role. So early days, but something that we're quite passionate to take forward.
Thanks very much. I'm thinking that your question is related to mental health services in particular, Maureen, is that right? Mental health services? No, no. Yeah.
Maureen, I think we've got the points you're making, and Jackie's going to come to what you've just been saying.
I think it's something that when we bring forward the redesign of community mental health teams, that will be something that we will address. We will need to be thinking about how we address some of the backlog for appointments, for example, locally, and how we will do that. And it won't just be about advanced nurse practitioners, but we need to think creatively around how we will manage that. And it may be that there will be a short-term requirement for an injection of additional resource till we sort out some of the waiting lists and backlog that are there. But I'm conscious that Peter Lefevre is no longer in the meeting with us, but something that we're actively engaged in discussions with him at the moment. Thanks.
Thank you very much indeed. I do want to move on, unless you've got a final burning question, Martin.
To get this thing to work. That's the one. Is the development of advanced nurse practitioners across the service actually highlight how we've been running a service nationally for a long time, that we're starting to bring, is that de-skilling or dumbing down some of the hierarchy?
I'm looking at Sarah. I think I'm going to ask Sarah to finish off this one. Thank you, Sarah. I think it's more positive than that.
Yeah, so advanced practice is critical to career development and opportunities to recruit and retain nurses, allied healthcare professions and others into advanced practice roles. This has been going for well over a decade in terms of the programme. It's fully supported by NES and it culminates in some post holders then achieving nurse consultant status. So nurses never will be a replacement for medical staff, but there are still some skills and opportunities and development that they bring which is unique to advanced practice that they can offer in that space and complement the practice of medical practitioners. So if there's any additional detail you need on advanced practice between Valerie, the lead nurse, and myself, we can provide that for you offline if you need connections. Thanks.
Sheila, very briefly, please. I want to make sure I keep the meeting going because I want to catch someone before they leave at 4. Thank you.
That's okay. It's very, very brief, and it's really about the presentation of the information, which is very good. But I'm just wondering if a consideration could be given to providing something on a timeline with key milestones, so we can understand how each of the individual actions are progressing. That's all. Thank you.
Thank you very much, Sheila. Point noted. And the report is presented to us for noting. And thank you very much. I think there's obviously, this will be an ongoing discussion. Workforce is our #1 issue. Thank you very much indeed for all your contributions to this. I'd now like to move to the information section, which is 8.1, reporting forward planner for information. Are there any comments on that? No. 8.2, future meeting dates, and some of these already happened actually, I think. Yes. Anyway, thank you. So we look forward to seeing you again on 21st of June, but we'll see each other for the development session on the 5th of May, which I think will be a very engaging session. Thank you very much indeed, and that formally concludes our meeting today. Thank you so much for everyone's participation today, and I hope you found the meeting useful. Thank you.